I have some new information about Mr. William Bryan. He is the 70-year-old man who was killed on August the 21st, 2024, after a surgeon removed his liver instead of his spleen. Earlier this afternoon, there was a press conference held by Joe Zarzer of Zarzer Law in Pensacola, Florida. He is the personal injury attorney who is representing the Bryan family. So here's what happened. Mr. William Bill Bryan was down in Destin, Florida with his wife Beverly, visiting their rental property there. Now, this was on August the 19th of 2024. On that day, Mr. Bill started having some left-sided flank pain that was, it sounds like, radiating to his left shoulder and his left neck area. So he and his wife, Beverly, who was a registered nurse, decided they were going to go to the local emergency room, which is Ascension Sacred Heart Emerald Coast. So they're in the ER. Mr. Bill is having this left-sided pain, and they end up getting 3 CT scans with contrast and 1 MRI. Beverly says that the first CT that was done in the emergency room, it was documented by the ER doctor that there was or had been some bleeding on or around Mr. Bill's spleen, but that it was not active bleeding. So Bill and Beverly decided that they really wanted to try to get Bill home so that he could have surgery by people that he knew. They even contacted his primary care provider in the Muscle Shoals, Alabama area, and their physician, their primary care physician, said that he would have all of the surgeon's staff ready to go to operate on Mr. Bill as soon as he arrived home. At this point, Dr. Shaknovsky, the general surgeon there at the hospital, is involved in the case, and Beverly is having this discussion with him, and he tells Beverly, if you take Bill with you, his spleen will rupture and he will bleed to death. You won't make it. And also reportedly in on this conversation, trying to persuade Bill and Beverly to stay there so Bill would have the surgery there at Ascension Sacred Heart Emerald Coast, was the chief medical officer. So Beverly says that they feel like they have no other choice, and we would all feel that way, right? So they allow Dr. Shaknovsky to admit Bill to the hospital, and they were checking Bill's labs, especially his hemoglobin and his hematocrit, which indicate bleeding issues, every 8 hours, and that for the first several checks, his hemoglobin was hanging out around 14 and was kind of staying steady there. And then on August the 21st, his hemoglobin dropped down to 9, which is low, but not low enough that we treat that. We don't treat a low hemoglobin with a blood transfusion until it hits 8. So at this point, Shaknovsky convinces Beverly that he has to take Bill to surgery. So Bill's in surgery. Shaknovsky is initially doing a laparoscopic procedure where he is supposed to be removing Bill's spleen. Now, eventually something happened and Bill had to be opened up kind of the old-fashioned way. The laparoscopic procedure was not working, so they cut him open, they cut his abdomen open, and Shaknovsky cuts through the vasculature of his liver and he removes his liver. And Bill bleeds to death there on the table. So the liver that Shaknovsky pulls out of Bill, he labels as spleen and puts it in a container to send it off for the pathologist to review it. On Mr. Bill's death record, it has 3 causes of death listed: hypovolemic shock, hemorrhagic shock, and splenic hemorrhage. Now, there was a post made on FB, I'll show it to you guys here in the background, where it looks like they were initially told that Mr. Bill had an aneurysm. I have not heard Mr. Bill's wife, Miss Beverly, say that, or have I heard Joe say that, but this is posted by, I believe, his daughter. So the pathologist gets the tissue, does the pathology on the tissue, and realizes this isn't spleen tissue, this is liver. And the pathologist notifies the medical examiner of a problem. It's reported that the medical examiner tried to get other tissues and reports from the hospital, and that initially the hospital was kind of resistant to that, and so the medical examiner does an autopsy and finds on the autopsy that Mr. Bill's spleen is still there and his liver is gone. And on his spleen, there was a very small cyst that was found, but it was kind of described as a normal looking cyst, not one that would cause any sort of life-threatening injury or illness or complication. And at that point, I suppose the family was notified, and then they hired Joe Zarzer of Zarzer Law. Now, let's talk about the lawsuit. There has not yet been a lawsuit filed because in the state of Florida, before you can file a medical malpractice lawsuit, you have to go through something called a pre-trial suit. It's reported that the operative note documents nothing except a splenectomy, that the pre-op and the post-op diagnoses are both splenectomy. All right, so this pre-suit period is where there is kind of private litigation between the attorneys of both parties where essentially they try to settle without having an official lawsuit filed. And Joe said in that press conference that on paper, those typically last 6 to 9 months. However, usually it's much longer. And although this sort of thing can work in a lot of situations, Joe does not believe it will work in this situation because he does not believe that the hospital will accept the amount of culpability that really they should. Clearly, they knew that there was an issue because of the suit that was filed in 2023 with the person or the patient who had a portion of the pancreas removed instead of their adrenal gland, another wrong site surgery that also happened at this same hospital, Ascension Sacred Heart Emerald Coast. Joe did also mention that he has had other patients to come forward to him. I've also had patients message me about situations that happened with this same surgeon. Of course, I've referred all of them to Joe. In addition to these civil claims, there is also an ongoing criminal investigation by Walton County Sheriff's Office into Dr. Shaknovsky. And that charge is probably going to be culpable homicide or gross negligent homicide, which is the same thing in the state of Florida. Someone from the hospital has reached out to apologize to Beverly. It is unclear if he is still on staff and has privileges at that hospital. He has been removed from the social media of several facilities, but it is unclear whether or not he still has privileges. Now, we know that he does not still have privileges at North Walton Doctors Hospital because they did reach out to Joe and let him know that, hey, like, we cut our ties with that. So good for y'all. When asked what the goal was for these civil claims, Beverly said that she just does not want this to happen to anyone else. And my condolences to the family. I teared up a few times listening to this press conference. I want to read a few things that Beverly said about Bill. Their 33rd wedding anniversary was 2 days after he passed. She says he was such a good man. They had 3 kids and 8 grandkids. And he was a Boilermaker. He had worked hard his entire life to afford the little rental property that they had in Destin. She says he was a wonderful father and a wonderful grandfather. He loved Alabama football, he loved old cars, and he loved his family. She also said, and I want to read this, that she is heartbroken and angry that Bill isn't here now due to the incompetence of doctors involved and the negligence of Ascension Hospital. They took him from us when he was completely helpless on the OR table, and it's really just so sad. It's a tragedy. You trust your life with healthcare providers. You trust your life. And sometimes even more impactful than that, you trust the lives of your loved ones to these people. Just imagine if this happened to your father or your grandfather or your spouse or your child. It would be horrible.